Rayvn Sampson, College of Nursing. We're here to do a teaching session about child asthma. My name is Vivian Avant.
My name is Rayvn Sampson.
My name is Demarsha Archer.
I'm Brittany Williams-White. And I'm Ashley Menchaca.
Okay, so just to kind of break the ice a little bit, we'll do like a little icebreaker. So because our topic is with asthma, and we're in a school with kids, so how many of you know what asthma is? Just by a show of hands. Okay, cool. How many of you have experienced or seen an asthma attack in play? Okay. And how many of you have responded appropriately during the asthma attack? Well, great. Okay, well, this presentation will kind of give you a little bit more insight, and it'll basically let you know whether or not you responded appropriately, and if you didn't, you know now how to. Okay.
Okay, so I'm Demarsha, and I'm going to describe the disease process of asthma. So asthma is a chronic inflammatory disorder of the airways. If the child is exposed to any allergens, pollutants, cold weather, or physical activity, it causes their airways and the lungs to hyperreact, where the child will have an inflammatory response, as well as their airways will close in. So the first sign of symptoms will be like they'll start coughing. They might say they might be short of breath, and it often occurs in children and can last through adulthood.
Okay, so with the classifications, with the literature, it basically classifies it according to how often or how frequent the child might have asthma attacks. You have mild, moderate, and severe. But something to keep in mind with like reality postings, like I know personally for myself, I might not have had an asthma attack 2 or 3 times a week, but that does not say that I don't have asthma or an asthma attack cannot occur. Sometimes, as you'll see throughout the presentation, as a child gets older, they can avoid some of those trigger things that can cause an asthma attack. So this is just basically whether or not the child has an asthma attack less than 2 times a week, more than 2 times a week, a daily, or continuous throughout the day. So hopefully we don't see those type of severe situations.
Okay, for the triggers and risk factors, these are some things that you want to look out for, that you want to avoid if you are an asthma patient. So if you have an asthma patient student, you want to be able to tell them to stay away from these different triggers and risk factors. Allergies, it can be a food allergen, like peanuts, or it could be an animal, like the fur from the animals can cause asthma to trigger, or pollen. So environmental stimulus can cause asthma to trigger. Air pollutants, exercise. If the child is exercising a lot, then that can cause their asthma to act up. Occupational factors, which is wherever you work, like a chemical plant or warehouse. Respiratory infections can cause asthma. Strong emotions, like if you get mad or if you get sad, like those are things that you want to teach the student or anybody that suffers from asthma to stay calm, try not to have emotional ups and downs. Sudden temperature and humidity changes. We live in Houston, so we know the weather is kind of crazy. One day it could be hot, and the next day it could be extremely cold. Well, our version of cold. But we want to make sure that they, have the proper clothing for each condition. GERD, which is it's acid reflux. And we want to make sure that they take control of their acid reflux. And food additives, like things that's in their food that can trigger asthma. Some things that the students or anybody that has asthma can't really prevent is the gender. Some men or female, or it's not really gender set. A man or a female can have asthma. It just depends on how you were born, which would go into the genetics. So if your parent has asthma in their family and they pass it to you, then you're more susceptible to having asthma as a child. And then age, we're talking about children right now, so it's more prevalent in children. we hope that as an adult you are able to avoid these things, so you'll be able to stabilize your asthma, and so it can be better treated or better treated in the long run when you become an adult.
Hi guys. So these are some signs and symptoms of a patient with asthma. These are the things that you would look for in that patient. So they might be wheezing, they might be coughing, their chest might become tight. You'll want to look for like maybe if they're like, you know, holding onto their chest or like grabbing their neck, so they're like signaling to you that they can't breathe. That's really important. Anxiety, you know, when patients have asthma attacks, they get really nervous and they have high anxiety, and that could, you know, make it worse or make their asthma attack worse. So these are some things that you would look for. Bronchospasms, you know, that's a tightening of the bronchioles. Edema, like we said, coughing. So you just want to look for those symptoms so that you could be aware and you'll know what to do in the event that you see that happening. You know, so you'll know the next step to take in case that does happen. But yeah, so I would just look for like they're trying to gasp for air. You would see their accessory muscles, them breathing with accessory muscles. Yeah, so that's pretty much some symptoms of asthma.
Okay, so for medications, y'all probably know what this is then. If you have asthma or have seen asthma attacks, this is the inhaler. This is like the rescue medicine. This works to basically, in an asthma patient, you'll have their airways, of course, on a normal day, no asthma attacks, it's open, clear, things going through, breathe in and out, no problems. But when some of those triggers or some of those signs and symptoms begin to occur, such as the shortness of breath or wheezing, that's like the most common symptom you'll hear in a child, kind of like it's you've heard of wheezing? Okay, well that's what you'll hear. In that case, the airway is basically going like this. It's closing, it's closing, it's closing. This rescue medicine, basically, when they put this in, it's so important that how this is used, because you can puff it in, they can hit it, you heard the noise, but if they don't breathe it in with the full lung capacity, it does them no good. It just basically hits their tongue and that's it. So you can still hear that child wheezing. But this is supposed to be what they call short acting. Takes hardly any time to start working. You don't want a long acting or anything like that, because in an emergency situation, you want the child to start breathing immediately. So this is one of the medications, and of course this is how it looks. And you go to the next slide. This is basically talking about, this is what they call it, a meter dose inhaler. And these are just the ways, kind of like how you would go about with the child taking it. Like I said, of course, you don't want them chewing gum, any objects in their mouth of any sort. We want to remove the cap. I've already done that. Holding the inhaler down, and then we'll actually have like a video to give you a visual of how this actually rolls in play. But if you've been in a situation, then you're probably a little familiar with it. The video would have been demonstrating would be simply that you're having the child kind of sit upright. You want to try to get them in the calmest state possible. If they're hyperventilating, that extreme, like, you know, if they're trying to breathe, this might even cause them to choke. So you want to try to get them as calm as possible. And basically it's saying you want to use a spacer, if not, but basically you just put it to their mouth and you'll have them hold it in, and you want them to basically inhale as much of it as possible. So the deeper the breath, the better it'll go. And generally, depending on the prescription, it's generally like 2 to 3 puffs, but then you have to go based off of the situation, because this should start to act immediately, so you should start to see some type of difference. It says you can count to 10 slowly, you can relax in between each puff, because after the first one, they really should have a little bit calmer state. Then you can do one more, and then if the situation is still not where it needs to be, of course, you can call 911. Now the peak flow, that's probably something that maybe the nurse station may have and it may not be, but this is basically a preventative measure. This would be kind of an instrument, I don't have one of these, but it'll be almost about the size of maybe one of those water bottles, and it'll be clear, and it'll basically have numbers, and it'll have a green zone, yellow zone, and red zone. So what you'll have the child do is you'll have the child to breathe inside of it. It'll be like a little mouthpiece, really similar to this. Depending on how it's like a little silver ball, how high it goes up with how much air they put in there will let you know whether or not they're breathing at their best. Meaning green, of course, is they're good to go. Yellow, have to be cautious. Red, maybe this child should not go outside. So this is kind of a preventative measure. This is not always, I want to say here, this is more of a hospital type of thing as well. But if the nurse's station does have it, it's really good to use. If you see that the child might be walking a little slower or they're not actually at their best today, maybe they shouldn't go forth and do as much as the other kids. This will be a way for you to basically, whatever you're feeling, you can assure it by this measure.
Okay, so this is what to do in an emergency crisis. Some of the signs that you'll find during an attack is shortness of breath while just walking. Sometimes you have shortness of breath, while you're doing stuff, but this is just walking or even just talking. Or you're unable to lie down and breathe, and all the other signs will get worse, like the wheezing. Instead of it actually, like you think if it goes away that it's good, but it's actually not. Sometimes if it goes away, it means that it's just completely constricted and nothing's coming out. So the first thing you want to do is do not panic, because panicking will make them get more anxious and it will not help them out at all. And a way to kind of decrease anxiety, you can do pursed lip breathing, and it works to do it with them because it kind of calms them down. Because if you're like, do this, do that, do this, and it's not gonna do anything with that for them. So what you do is kind of like breathe in, and then you want to purse your lips, like if you're gonna use a straw, like, so you're gonna breathe in once, and then you slowly to 1:4 ratio. So you use your quick inhaler, like she said. You do the 2 puffs initially, and then for every 20 minutes for 2 hours until it kind of goes away. And then you can administer a corticosteroid, which that blocks the inflammatory system attack, which is causing the mucus and all that, which is also blocking the airway. And then if nothing helps them, of course you want to call 911 immediately.
Okay, you all, we're gonna play like a little interactive game. On my slide, I talked about the allergens, the triggers, and the risk factors. So I'm gonna point at each picture, and I want you to let me know what trigger am I talking about. So anybody can answer the first one.
Pollen.
Oh, okay.
First space. It should go away. There you go.
Pollen.
Pat dander.
Okay. Yay. Go to the next slide.
Weather.
What's that what?
I heard what?
No,
She
weather.
said dust. Mold.
Okay. You gotta watch that out for the food.
Yeah.
I don't think people just eat mold, but
Or they could live in
kids
it
don't
in that
know.
kind of
But they
condition.
need mold, like,
yeah.
Yeah.
Some kids may not know. They're like, oh, it's still a piece of bread. But you have to tell your children, no, if it looks green, don't eat it.
Food allergies.
Food
Food
allergens. Food allergens.
Smoke.
Smoke. This is a big one.
Cigarette smoke.
This is a big one. A lot of children may live in environments where their parents or grandparents, whoever they are, their guardian, may smoke, and they are constantly in the hospitals, and their guardians asking, why are they having so many asthma attacks? Because you're smoking. That's the main one.
That's together.
Those two are together.
Emotional triggers.
Emotional triggers. Okay.
Exercise.
Y'all are good.
Weather.
Okay, so that is that's the weather. Same temperature.
Cold.
Immune system.
Mm-hmm. Infections, viral infections.
So just to conclude with what we've presented as a whole group. So now seeing the presentation, of course, I had about a show of hands at the beginning. Most of you did tell me, well, all of you did, that you know what asthma is. So is that still the case?
Yep.
Do you feel like you've learned more about asthma, maybe more than before?
Yes.
Well, maybe after you're going to have kids. You know a lot. So you know a lot. Okay, so now after the presentation, just kind of by a show of hands, like, how many now think that you can respond a little bit more appropriately, possibly, or no? Okay, and by, would anyone like to share, maybe, what they would do differently, or?
I think for me, like, I didn't know the one about the emotions, like emotions could trigger it, so that's something new that I learned. So maybe just kind of keeping them themselves, it'll help them catch their breath sooner.
Or you'll catch the emotions, it's test anxiety.
Test anxiety.
Test anxiety as well.
That's a
When
one.
big tests come up or
Oh, yeah.
when different things in school are really kind of just like stressed upon, it's a very important factor that can cause that type of stress on the child. And they don't do it intentionally, it happens naturally. Like most kids get hyped up anxiety, but along with their anxiety, they unfortunately have asthma. So it can also trigger that as well. Anyone else?
The proper use of the inhaler, I mean, I don't think I knew, I thought it was just puff, actually making sure the child's breathing it in, making sure they're actually getting the medicine.
Yeah, because that's really important because I've done that myself. I'll use those, like, okay, I got it. And then it's like, I'm like, I feel absolutely no different. You know, I'm sitting here breathing, having trouble, and then it's like I really have to slow down and I have to take a deep breath, puff in, and really inhale because do your children take breathing treatments as well?
They did when they were smaller,
When younger,
but now
yeah,
it's,
the inhalers. But even with breathing treatments, they teach you that you have to inhale as much as possible, like so that it can reach its full capacity and touch all the areas where you're having the problems with the airway. So that is very important. Because you can just be wasting a little medicine in here, just puffing away, and the child's still having problems. Anyone else?
And it's just really important to make sure, like, if you guys have a child that has an asthma attack, don't panic. I know, like, especially if you haven't seen it, it's probably something that is like, you're like, what do I do? You cannot panic because, like I said, anxiety is a sign and symptom of asthma. You're only going to exacerbate the attack if you panic along with the child. So just do your best to be calm and figure out what it is they need, you know, first. Get them to try to relax and get their albuterol, and then it should be good.
So I have a question.
Mm-hmm.
So the other day we did have a student that was having an asthma attack, and should we have them lay down? Like if I can't get his albuterol, like if he didn't have his inhaler here and we're waiting on mom to bring it. Should
That's
he lay
actually
down?
that's the worst thing you can do. You have to keep them. You have to keep them up, yeah, and then in a
Sitting
tripod.
like this, just so that they can open up that airway and get some air. Like even if you like just put your arms like this,
Keep
and sit
them
up.
sitting up
Yeah.
while we wait for the inhaler.
Yeah.
Okay. Gravity. Like if you're laying down, it takes more to breathe versus sitting up.
And then
So
your lungs will
that's-
be more expanded when you're sitting up than when you're laying down.
Any other questions?
Well, I just wanted to add another point. Like the overall goal for us teaching you is that with asthma attacks, it increases hospitalizations of the child, and it also increases their school absences. So it always starts with the teacher when the child is exposed to an asthma attack. So that's our goal in preventing, so they won't miss as many school days.
And it's also important that if you do have an asthma student that, I don't know about the nurses here, that they let you all know so you'll be aware, because I know it could be a traumatic experience for you all that you're teaching, and then a student may have an asthma attack. And so that's why I think it's very important that the nurse educates you all, and then you all become educated so you can help the student.
Well, that's all. So whatever you learned today, don't be afraid to share.
Thank you.
Well, thank you.
Thank you guys.
Appreciate you guys.